This is about the questions that we get asked every week. This is more for employers, but we will also be addressing issues for allied health professionals, assistants and prospective AHAs. One of the questions that I get at least once a week is, can I employ an allied health assistant that doesn't have formal qualifications, and can they become members of AHANA, and how does that work? So I'm going to go into that. The answer is yes. I thought I'd briefly touch on sort of the legal versus the governance issues. I'm not going to go into that in a huge amount of detail, but we do get a lot of confusion in that space. Issues of supervision and delegation, the insurance implications, and also just sort of touch on some safe workforce development. And look, these are the kinds of themes underpinning almost all of the questions we get. So in further FAQs, we'll explore those in more detail. And as I said, I'm happy to answer any particular questions you might have. So just to be very clear about the definition of an allied health assistant, and this was agreed, and Sally, we're recording this and we'll make the slides available. So they'll be on our website. The definition of an allied health assistant took quite a lot of consultation with the board and with external stakeholders, including some service users. The points I want to really emphasise here are that allied health assistants are a healthcare worker with demonstrated competencies to provide person-centred, evidence-informed therapy and restore and maintain function and so forth. But what we really specify is that they need to be working within a defined scope of practice, which is delegated and supervised by an allied health professional. So those two things are essentially our guardrails for people to come in and be members of AHANA. And as you can imagine, that is kind of difficult for us to govern, but they adhere to a code of practice that says that will do that. But that really sets the framework for everything that we do within AHANA. I'm going to come back to this point as well. We have a lot of confusion about what supervision actually means, so I'm going to touch on that in a bit more detail. So why did we start AHANA, and what are the problems that we're trying to solve? Well, one of the issues is that, as you'll know, anyone could go out tomorrow and set themselves up as an allied health assistant, particularly working potentially in the private sector. And every allied health assistant develops a unique set of skills based on the type of context they've worked in, the types of clients that they've done. And it's very hard for them to verify that they've got those skills and transfer them between settings. What we're trying to do is ensure that there's a consistency of standards for allied health assistants. And so that when someone says that they're an allied health assistant and a member of AHANA, that the employer knows that that implies a certain level of quality standard and rigour around that workforce. And that model also applies to the rest of our self-regulated professions: dietitians, speech pathologists, exercise physiologists. There are about 16 of them. So it's a framework for verifying quality. The other point that this helps to support is how do I know that I'm employing an allied health assistant that is safe and credentialed? So we provide the quality frameworks, the safety frameworks that are transferable across different settings, and I'll explain how we do that in a moment. We're also building workforce capacity and capability. When we first set up AHANA, we estimated that there were between 25 and 30,000 allied health assistants in Australia. We now think it's probably closer to twice that, but we don't really know because there's no workforce planning for them. And a bit of a sore point is that allied health assistants are still not explicitly likely to be included in the National Allied Health Workforce Strategy. But we don't have accurate numbers, but based on extrapolation from public, private and SEEK data, that's what we believe. And a really important role that allied health assistants can play is, we know that we don't have enough allied health professionals. We know that we have a lot of needs in the community, particularly in NDIS and aged care. So we can mobilise a workforce with the appropriate skills to meet the needs of those people and work across existing professional boundaries to do it. What is AHANA? AHANA is the peak body, the national peak body for allied health assistants. And I think we're all quite proud to say, as far as we know, this is the first time that any association has been set up anywhere in the world as a self-regulating body for allied health assistants or support workforce. We support and promote and advocate for allied health assistants across Australia, and we've been doing a lot of work in that space. We've been advocating with the NDIS, the Department of Health and Aged Care, the Chief Allied Health Officer, with state leads, and we do try and promote our advocacy in the newsletter each month, so keep an eye out for that. And if there are issues that you'd like us to advocate for, let us know. We're very lucky to have Alan Groth, who has been a Senior Policy Officer and all the with SARA, Services for Australian Rural and Remote Allied Health. So we know we have a very good advocacy pipeline for AHANA. But most importantly, we administer the AHA certification scheme. So we set the standards for the allied health assistant workforce for membership for AHANA, and then by becoming members, we reinforce that through ensuring that people adhere to their code of conduct, complete CPD, and create a community of practice. And I'll go into that in a bit more detail. In particular, we look at how we can mobilise the AHA workforce to the benefit of the service users and employers in the community. Self-regulation, people get a bit confused, and everyone thinks that the pinnacle of becoming a profession is getting AHPRA regulation. We've been very lucky to have advice and input from some of the top regulation experts in the country, in particular Anne-Louise Carlton, who was actually involved in setting up the national regulation scheme for AHPRA. But what we know for allied health assistants is that there is no mandatory regulation, and only about half of the allied health workforce are regulated with AHPRA. So there's no statutory title or mandatory register. But that means that puts the responsibility onto employers then to verify the quality of the workers that they employ. So what self-regulation does for allied health assistants is provide a signal of quality. So you've got workers who have agreed to adhere to a mandatory code of conduct. They've been assessed that they're working under supervision and delegation. Our general and certified practicing members have met minimum qualification and working levels, and they also have insurance and CPD. So what it means is that anyone who is a member of AHANA can basically tick a box and guarantee a minimum level of quality for their employer so that the employers don't have to do that. We also have a public register. So not everyone's on the public register, it's voluntary, and we recognise that there are a number of privacy issues, particularly in DV cases, but AHANA members can choose to be on the voluntary register, so they can be findable and verifiable. So that's another mechanism for ensuring the quality of the allied health assistant workforce. So I just wanted to touch on some of these questions that I raised early in the presentation. Can you employ an allied health assistant that doesn't have formal qualifications? And I think, Sally, you also pointed out the question that comes up also every week. What about being able to employ allied health profession students? So the answer at the moment is yes, you can employ anyone as an allied health assistant effectively, but as the employer, so there's no law protecting the title, and we at AHANA recognise that the gold standard for training for an allied health assistant is the Cert 4 in allied health assistants. But from a governance perspective, again, you can employ an allied health assistant, but you are accountable for the work that allied health assistant performs. So you're fully responsible for ensuring that they are competent to perform any task that you delegate to them. And that's really important. And I'll come back to that when we talk about the supervision arrangements. You need to ensure that you document those supervision arrangements, because if there's ever any question, someone will come back to you and say, how did you know that you were providing safe, and how did you verify the safety of the work that you were doing? You need to make sure that you are covered by insurance. And this is one of the big reasons that employers come to us, because once allied health assistants are members of AHANA, they're eligible for their own insurance through insurance company BMS. So that takes some of the pressure off, but not all the pressure, and I'll go into that again in a moment. And you also need to make sure that you meet the requirements of your funder, whoever that might be. NDIS is a common one, but we know that there are other funders. So the other point is to be transparent about the titles that you're using. And again, with membership to Allied Health, to AHANA, you can use post-nominals. So someone can say they're an AHANA member provisional or AHANA member general or AHANA member certified. So that gives another level of quality or verification. The other thing that we strongly suggest is that you enrol your Allied Health Assistant in the Cert 4 pathway. I just want to touch on the point that Sally asked, which is, can I employ allied health professional students as allied health assistants? And again, the answer is, of course, yes. One of the questions that comes up is, should they become a student member of AHANA or should they be a practicing member? Membership to AHANA, if anyone is practicing as an allied health assistant, they should be a practicing member. If they don't have a Cert 4 or a Cert 3 or equivalent, they will get provisional membership. So as long as they're working under supervision and delegation of an allied health professional, they're eligible for provisional membership, and then that will give them access to insurance and that protected title. The other point I'm going to make here, because it comes up a lot, is we get people coming in with allied health professional qualifications. I had someone come in with a master's degree in leisure studies recently, and they expected that they would automatically get certified practicing membership because they thought that that would be equivalent to a certificate 4 in allied health assistance. One of the things that we really look for when we're looking for equivalence is that people understand that delegation framework. There's a huge risk if we've got someone with a master's degree in an allied health profession working as an allied health assistant, that they will work in a non-delegated framework, and the allied health assistant role does not cover that. And if also their AHANA insurance will not cover that. If you want to work as an occupational therapist, you need to be registered as an occupational therapist and working in that role. If you're working as an occupational therapy student, as an allied health assistant, you need to be a member of AHANA to get the protection that we give you. I'm happy to talk about that more because that's another weekly question that we get up. Supervision and delegation, and again, this is an issue that comes up all the time, and this is also complicated by who the employer is. So in effect, an allied health assistant has to have their work delegated to them by a qualified allied health professional. And we include a lot of people in allied health professionals. We had, in fact, every allied health, pharmacy, psychology, and so forth. The person who delegates the work is responsible for that work. So they need to make sure that the person that they're delegating to is safe and competent to do the work, and they need to have some kind of supervisory relationship to that person. That does not mean that they need to employ that person. So one of the big questions that comes up is, how can I delegate to and supervise someone that I'm not employing? Well, the answer is that you can do that, and we have lots of examples of where that happens. Someone can be self-employed, but you need to document the paper trail between that supervision and delegation relationship. So I put 3 types of supervision here. One is the delegation supervision. That's when I hand a role to another person and I say, I'm making you responsible now for this work, and I know that you've got the skills because either you've got the qualification or I've seen you do it, or you've shown that you're competent in some other way. And I'm going to check that you're doing that work in this way. I'll read the records, I'll check in with you, I'll check with the client. And that supervision relationship is context specific. You can have remote supervision if it's appropriate. I guess the point I'll make is you do not need to be in the same room as the allied health assistant, but my background's podiatry. You probably want to have watched someone do 10 basic foot care assessments, or at least seen the outcome of them before you deem them to be competent. So you want to have the processes that show that you've verified it. Within AHANA, we're looking at how we can make those processes more and more transparent, but there's obviously a lot of work to do and we've got a limited resource at the moment. The next type of supervision is the employment supervision. So this might be who does the rostering and who pays the bills. And that is separate to delegation supervision. That could be a manager doing that, or it might be a person that isn't actually overseeing the work. So you need to separate between those. The other point is about reflective and professional supervision. So we've had some queries from employers saying, I need supervision for my allied health assistant, but I think they're thinking about it in the way that psychologists get supervision. So psychologists work autonomously, they have their own client load, and they work with external supervisors that they pay to check in about their different aspects of their work. That is appropriate for allied health assistants, but whoever is delegating the work, this is a delegated workforce, they need to have that delegation supervision relationship in every single case, and we'll be looking for that in our members. I think I've probably answered the how often. There's no mandated frequency, it's context specific, but you need to be able to put your hand on your heart if something goes wrong, and also your hand on some paperwork to demonstrate that, first of all, you had some proof that that person was able to do the work that they said that they could do, and that you had supervised them appropriately. Again, happy to come back to that if you need to. Insurance, this is probably one of the biggest reasons we're increasingly getting people joining AHANA, because not all insurers will cover your allied health assistants. You need to know when your allied health assistant is covered in your practice. So what we suggest is that you check your own insurance policy, and two types of positions can apply simultaneously. The employer's liability that covers the AHA's actions as employee, but you also want the delegating AHP's professional indemnity cover to cover their clinical decisions and supervisory adequacy. So if you've delegated something to another worker, you need to make sure that your own insurance as a delegator will cover that. So AHANA members are eligible for professional indemnity insurance through BMS, and so that is a really good way to manage some of that professional indemnity insurance, but you still need, as an insurer, as a practitioner, managing a clinical load and delegating, you need to make sure that you are protected as well. So I think this is one of my last slides. How can you create a good pathway to ensure that you've got a safe workforce? First of all, employ the right people, and we've got a employment page now up and running on the AHANA website. We also, and so that is one way of looking on the AHANA register, so you can make sure that you're getting a AHANA member. I was really pleased talking to Sky earlier. She said that she will only work with and employ AHANA members, so it is a way of ensuring that you're getting some quality assurance. Making sure that they have that supervisory relationship absolutely clear. So what is the supervisor relationship? Where is it documented? How are you going to monitor it? And how are you verifying that delegation framework? Andy's done some really nice resources on competency-based task allocation. How do you work with your allied health assistant to demonstrate competence? And until we've got some really nice frameworks, and we are working to develop those, it's probably something that you need to do on a case-by-case basis. So have you witnessed your allied health assistant doing X, Y, Z, and what sort of training have you provided for them? The other thing to look at is the risk status of those tasks. Some will be higher risk than others, so they'll obviously need more governance around them. Already talked about formalising and documenting the supervision. Make sure you have a clear paper trail, and ensure that you have a formal training pathway. I just saw Elizabeth asked a question. Does BMS cover delegating allied health professionals in their insurance offerings outside of AHANA? The BMS insurance cover is specifically for the allied health assistants. So the BMS is an insurer of allied health professionals, so you need to check that with your own insurer. But we're increasingly recommending to allied health professionals that they check what their insurance actually covers. Some insurance does cover that delegation relationship and actually covers the allied health assistants in practice, but it's not universal. So I'm just going to do a plug for AHANA. We are really there to set the standards of quality for allied health assistants, and we're starting from a base where we have no standard qualifications and a very diverse workforce, and we're slowly bringing this quality together and the awareness of the workforce. We've only been going for 3 years, really, 3 and a bit years, and I think we've achieved a huge amount raising that awareness for allied health assistants. Allied health assistants have to meet minimum board endorsed standards of entry. They have to adhere to a code of conduct, and that's actually really important. They sign up that they will adhere to a code of conduct, which means that they are agreeing to working within that delegation and supervision framework. They're covered by insurance. They maintain professional development. They have to do a minimum of 20 hours of CPD a year, and we provide access CPD. We have a complaints procedure. Fortunately, we've had no complaints yet, but we do have the processes within the board, and that's a really important mechanism for us to ensure that we uphold the quality. And we also have access to peer support. So from this month, we've reinstated our peer support water cooler sessions where allied health assistants can get together with an experienced allied health assistant. At this stage, they're all board directors, and just share their learning and experiences. And we're looking at ways of providing other forms of supervision support as well. Just quickly, we have 3 levels of practicing membership. I'm not going to go into these in any detail. If you want some more information, we've got quite good resources on our website. But any practicing member that doesn't have a qualification, so these are our allied health professional students, OT students, can become a practicing member provisional. So as long as you are working as an allied health assistant in a delegated role, you can become a practicing member provisional. That's our only entry criteria, and you adhere to a code of conduct. Practicing member general, you have to have at least 450 hours of practice experience or a Cert 3 as your minimum level of entry, and you'll straight away get practicing membership general. Practicing member certified has to have a Cert 4 or equivalent, and we're pretty tough on the equivalents, plus 450 hours of practice, and you can move between those. The other point I'll make is that student members are for people studying a Cert 4 in allied health assistance. So this isn't for the allied health profession students. It is literally for students of AHA Cert 4, Cert 3 courses. We have an organisation membership, which is $385 a year, and that includes GST. So you have access to AHANA's insurance program as an employer, but we work to advocate for you. You have access to members-only forums, resources and CPD events. You'll get discounted rates to AHANA events and networking opportunities. We'll provide you with a quarterly newsletter and workforce development updates, and we also would invite you to serve on AHANA committees and shape the workforce standards. So that's a really great way to support AHANA and for us to support you in return. So that's the end of the presentation. These are some of the other topics that have come up. If you've got other questions, we're really happy to answer them now or cover them in the future. But what's the scope of practice of an AHA? Andy's talking on that. We'll have more detail on professional and indemnity insurance. We'll spend a session on supervision. We always get questions about working in the NDIS. Workforce redesign and top of scope practice, what does that actually mean? Career pathways and the future of the AHA workforce, and that takes us to the end of the year. Any more information, you can get access to the website through the QR code or ahana.com.au. Thank you all very much for your time participating.
Yeah, I just had a question for Sky. Did I hear you right that you say that you only like to employ people who are AHANA members? Did I hear that right or not?
Yeah, that's correct. I was speaking to Susan about we're running some NDIS social skill groups, and we were needing another AHA to support, and the clinic where I work, they said that they'd be happy to share one of their AHAs, which I said was fantastic, but they needed to be a member of AHANA for me to feel comfortable employing them or subcontracting them for those sessions with the children.
And is that type of thing written into your job descriptions, or like, you know, when you're doing an advert for a job, is that something that you've written
Yes,
into?
so
Yeah, okay.
yeah, when I employed my other AHA about a year ago, it was straight away, it wasn't negotiable. It was like, yes, you need to
Right.
be a part of that. And she was happy to do that. And as a employer, I actually paid for her first year anyway.
Yep. Okay. Yep.
But saying that too, like she's in her fourth bachelor degree of early intervention as well. So
Yeah.
I was more than happy. She's more than qualified to work as a AHA, but I still wanted her to have that membership was still important to me, and especially in the NDIS field as well, where it's just important to have it, I think.
Yeah. So I do interviewing for AHA students, you know, positions that are available in our organisation. I'm thinking that kind of a conversation would have to be, I'd have to have permission from our organisation or backing from our organisation to say that, wouldn't I? Really? Like that would have to come from your organisation policies, or does that make
Susan,
sense?
did you want to ask that one?
Yeah.
Look, if you look at other self-regulating professions like Speech Pathology Australia and Occupational Therapy Australia, what they say, and in fact, you generally can't specify that someone, you can't enforce that they have to be a member of the
Yep.
association, but you can say eligible for membership of the association.
Right. Yep.
So there's
Yep.
no
I'm
risk
just trying to
about that.
figure out how I can
Yeah.
word that or say that. Like often when I do interviews, I will mention AHANA and say, "Oh, have you heard of them?" You know, and especially you know, on that first meeting and that. But I don't think we've ever really kind of like said, "Oh, we would like you," or "we'd prefer you to be a member." But yeah, I just kind of like wondered how you worded that into your conversation. But if it's very, very clear at the start, there's kind of like no conflict of
Yeah.
yeah.
That's
Yeah,
actually
to
really
be-
useful for us too, Sally. Thank you. Yeah.
Yeah, to be eligible for is always a good statement. We have had previous examples where they use the wording of "it is highly recommended."
Yeah.
Because like
Yeah.
my background, I work within public health, and then so of course there's professions that I work with that are other self-regulating professions, and the organization as a whole will state to them it is highly recommended that you are, you know, have qualities that make you eligible for association membership for your
Yeah.
profession. Because if they had two applicants going for a role and one did have that membership and one did not, they'd use that as a preference for selection as
Yeah.
well.
Thank you. That's helpful.
Membership's cheap. I should have put it there as well. Right now, for until about the middle of the year, we've really got discounted rates. So I think it's about $110 to apply, and at the moment, $99 application fee. But that will be going up because we've been providing AHA CPD for free, and we're going to need to put the fees up.
Yeah.
We're just taking that to the board. So
And Susan, did you want to
getting quick.
explain to what's involved with that membership as well? Because there's actually some really good PD. There's some really good things for, you know, especially new AHAs to have as well.
Yeah, I really love the PDs that come out. You know, that was one thing I probably struggled with the most, is finding relevant and PDs that, you know, we don't do PDs for the sake of doing PDs, but we do them to learn and grow, and finding something that was just so relevant. AHANA has really provided that. So that just been a
you're
big
wonderful,
bonus.
Sally. Thank you.
Yeah.
And
thank you.
we've used it a lot in our staff meetings when we'll do a bit of PD at the same time and do, you know, make up case studies. And a lot of the time, I'm like, right, where's Angie's last PD on NDIS? I'm going to use that as a, you know, our training for the staff meeting day. And yeah, it comes in handy. It really does.
Yeah. So for our organisation, so this last financial year is the first time that they've actually asked our AHAs to provide evidence of doing 20 hours of PD. So prior to that,
that's great.
it's never been. However, if we're a AHANA member, go straight through, and they so that's why it's been highly recommended about AHANA. So that's why I'm kind of like thinking, when we do interviews, how we word that in there, and we just still need to do some working around our wording and our job descriptions and things like that. But that was a really, really good initiative for when our organisation said, well, how can we prove that people are doing PDs? They had two options. They had to do stat decks, or they had to provide a certificate that they were a member of AHANA. So I thought that was a really great initiative too. Yeah,
that's
I was
great.
really
Thank
happy
you.
to hear that. Yeah.
Look, we've just updated some pages on our website, but I've just dropped into the link the benefits of AHANA. So professional recognition, professional development. So we've got the AHA CPD. So every month we put a new package up, and it's basically modularized into a sort of 1 hour session. And at the end of it, you can download a certificate to show that you've completed it. We've also got our water cooler event. So people, there once a month, you can catch up with your peers. We've previously negotiated discounted rates at conferences for AHANA members. Access to each other. But I think really the big thing now that we're getting is just recognition of what an allied health assistant is, and that it is starting to get that, professional relevance. And find an AHA, that's our register of allied health assistants. So you can find someone there. Any other questions or comments? We'll keep sending info out. Thanks again for your participation. Oh, Elizabeth's got something popping up. Right, thank you. We are, as you can see, we're a smaller friendly association. For those of you that came in late, Andy Richardson's our chair. Sky is on our stakeholder advisory committee and a great supporter, and briefly a director. So we're really grateful for the support. We'd love to keep engaging with you. Drop us a line, and we hope to see you at future events. Thanks so much, everyone.
I'm so glad you brought the water cooler sessions back. That's great.
Yeah, good. Thanks for your enthusiasm, Sally.
Yeah.
Bye.
Bye.